A pair of injuries that we see quite frequently in clinic are Little Leaguer's shoulder and Little Leaguer's elbow. And what this means is that the growth plate in the shoulder and elbow become irritated. This is due to frequent throwing and frequent use, and it's commonly seen in young throwers that are still growing. These injuries are the result of frequent chronic stress at the growth plate. So when a pitcher throws overhead, if they have poor technique or their shoulder is tired, this puts undue stress on the growth plate. The diagnosis of these injuries is typically made on the history as well as some imaging studies. So if we see a young thrower who comes in and is complaining of elbow or shoulder pain, it becomes very high on our list of problems that we think it could be. We frequently use X-ray to help us make this diagnosis as well. On X-ray, you'll see that the growth plate can become widened, and in some cases, parts of the bone can be fragmented or fractured. These injuries typically do have a prolonged recovery time. Usually if we make this diagnosis, we'll shut the athlete down from throwing for at least 2 to 3 months, and that will include all throwing of any type of ball or object. After that prolonged period, if the patient's having no symptoms, then we'll begin a return to throw protocol and program that starts with some light throwing at a short distance and eventually progresses the throwing to greater distances and greater efforts.